Well, I hope you have been able to complete the learning activities in the previous recording. Um, so let's now look at the funding and expenditure in the healthcare system, in the Australian healthcare system. So when we speak about the healthcare expenditure, we really mean who spends the money in healthcare, not necessarily just who provides the money. It's more about, you know, who spends the money rather than just who provides it. For example, public hospital expenditure is related to how the states and territories get to spend money on different health issues. And this is quite different from health funding, which, when we use the word health funding, we are referring now to who provides the fund to pay for health expenditures. And this can be observed at different levels of federal and state governments, but also users and private health insurances. As we started saying in the previous recording, the Australian health system is really complex and very hard to navigate. So this framework and chart you have here is just really to illustrate how complex the Australian health system is. So I'm not expecting you to really memorize everything on this specific slide, but as long as you can get to understand the different actors, including the state and territory, we should have the federal government somewhere here, and there are different responsibilities. So that should be just enough for you now to consider really this complexity of the Australian health system. Yes, so this is just really to give you an idea on how complex and even how complicated our health system is, and the many different actors who are involved, including the different concepts which you might see being used when it comes to the expenditures and who does what. You will see different lines meaning different things. The bold lines, for example, referring to all of the expenditures which are supported by individuals. And then you have the dot kind of lines indicating which of the expenditures can be supported by the government, are being supported by the government or other actors. But again, I'm not expecting you to memorize this. I'm just giving you an idea on how complex our health system and insurance of the health sector is in the Australian context. So then you have, what I did here was really to just color code the different expenditures and try to differentiate them regarding who spends, on which specific sector. And again, as I said, the main source of funding varies technically by the area of the health expenditure. So where the money comes from depends on the specific area of expenditure. And this is what I've been trying to color code here. You'll see that for some sectors or some areas of expenditures, the federal government does a lot when it comes to things like the pharmaceutical benefit scheme, the PBS, or unreferred medical services, Medicare and all those. The federal government tends to play a bigger role there. And I'm not really expecting you again here to get all the percentage right, but just again to really have an idea on who spends what on which specific issues. So then you have public and community health services being mostly the business of state and territory government, and specific things which are still under individual or private kind of not even insured, but people spending out of pocket, if I can put it that way. Things like dentistry and non-PBS medications. So yeah, those would include things like drugs which are being taken for recreational purposes, and anything like that. Of course, you might want to consider who spends more on those. So this chart here kind of summarizes the same information, giving you again more ideas on the amount of money being spent on specific health, sectors. And you'll see that much of the funding from the government is being spent mostly on hospitals, and you have some figures there. And of course, some of the money from the federal government are also being spent on primary health care. And then you see also a few details on what the state and territory government gets to spend also on the hospital and what they get to spend on primary health care. And you even have details on what individuals themselves get to fund. Of course, you'll see that individuals mostly don't get to fund hospitals, but much of their funding goes on to primary health care still. And of course, a few of their funding goes into referred medical services and all the other services which I have listed there. So again, this information, you can find more details on this on the website here. This is exactly the website of the Australian Institute of Health and Welfare. There is some online interactive material there which you might want to look at if you wanted to have more details.